This is an introductory lecture on pathology. We will discuss the history of pathology in summary, key definitions in pathology, as well as the classification of pathology. Pathology is derived from the Greek words pathos and logos. Pathos meaning suffering and logos meaning knowledge of. So this is basically a portmanteau. Pathology has been in existence in some shape or form for as long as man has suffered from disease. The earliest documented evidence of pathology dates as far back as around the 17th century BC in ancient Egypt, with the discovery of the Edwin Smith papyrus. The Egyptians had practiced embalming for several centuries, and it is through this that some macroscopic features of disease were observed and well documented. For example, tuberculosis of the spine. They were also known to weigh hearts, albeit as a religious ceremony. Nevertheless, it has found its way into modern pathology, with the weighing of organs being a mainstay of forensic pathology. The knowledge of the ancient Egyptians was added upon by the ancient Greeks, heavily influenced by the teachings of Hippocrates. Notable figures include Herophilus and Erasistratos, who are believed to be the first individuals behind human dissections. The ancient Romans also added upon the knowledge, with Galen significantly contributing to the field of medicine and pathology as a discipline. This was followed by significant advancement by various early Arab scientists during the Islamic Golden Age from the 8th century to the 14th century. Prominent physicians included Avicenna and Avenzoar. This period was followed by the Renaissance period that heralded a leap in knowledge and technology that facilitated growth of the new science. It was only until Rudolf Virchow, the German physician, had done several studies into cellular pathology that we now have the modern pathology we practice today. Rudolf Virchow is considered the father of modern pathology. His works also contributed to the abandonment of the humus theory, as well as the foundation for modern-day pathology. So key definitions for pathology include pathology itself. Pathology basically is the study of disease, but when we delve deeper into its meaning, we know that it also involves the investigations of the cause of disease and the associated changes at the levels of the cells, tissues, and organs, which in turn give rise to the presenting signs and symptoms of the patient. It is through the works of Rudolf Virchow that we are able to actually understand that disease is not only limited to the macroscopic, but also to the microscopic at the cellular level. Etiology is the origin of a disease, including the underlying causes and modifying factors. Complex interplay exists between nature and nurture for disease to manifest, most especially genetics versus environmental causes. This is seen in diabetes mellitus, hypertension, and cancer. It's also important to note that there are modifying factors which can actually result in the manifestation of a disease or the lack thereof. For example, malaria is a disease that is transmitted by the female Anopheles mosquito, but with modifying factors such as environmental controls as well as prophylactic ingestion of medication, we can actually prevent the manifestation of this disease. Pathogenesis refers to the steps in the development of disease. It describes how etiological factors trigger cellular and molecular changes to give rise to the specific functional and structural abnormalities that characterize disease. So whereas etiology was discussing the what of a disease, pathogenesis describes the how. How is it that these factors are all working together to bring about the particular signs and symptoms of a disease? Pathology can be classified into general and systemic. General pathology focuses on the cellular and tissue alterations caused by the pathological stimuli in most tissue, whereas systemic pathology examines the reactions and abnormalities of different specialized organs. We know that most cells have a general response to a particular pathological stimulus, and this is universal for all these cells. This is what general pathology looks at. However, in systemic pathology, we are looking at specific specialized organs and systems which have specialized and specific reactions to different stimuli. So, for example, respiratory epithelium will have a different reaction to noxious stimulus such as smoke than would, for example, stratified squamous cell keratinized epithelium of the skin. We also have different branches of pathology based on what particular field of pathology of medicine it deals with, and these include pathobiology, pathoanatomy, and pathophysiology. Thank you so much for your attention.